I'd like to invite up a good friend, colleague, and former Round 2 Presidential Innovation Fellow, Adam Dole, who's going to give us a demo of the Blue Button connector. Hey, Adam. Thank you.
Thanks, Ryan. You're welcome. So while we're getting this all set up here, I also want to bring up fellow Presidential Innovation Fellow, Tom Black, who had a lot to do with building the connector here, and he's going to help drive while I talk. I'm feeling a little insecure because the role of a fellow is supposed to cause trouble, but they invited us back. And so I don't know if we caused enough trouble last year, given the invite. But that being said, we're going to show you some of the stuff that we built, and we don't have very much time, so just launch into it. One of the first things we did when we got into DC last year and became familiar with what our roles would be as fellows was we went out and talked to people. And we got out of the building, we talked to patients, we talked to consumers, we talked to caregivers. And the one thing that we heard loud and clear were things that mattered to them. Time with their family, being able to reduce their costs, laundry list of things that mattered to them. What we didn't hear, meaningful use, what vendors their provider used, all the things that we talk about in this room. And while those things are really important because they enable a lot, what we realize is that we need to take a step back and approach this problem from the patient's perspective. And one of the things that we realized was that for patients to take an active role in their healthcare, they need access to the same amount of information that the care team does. Now, access is different than ownership, and we're not going to get into the stark differences there. But patients and consumers and people were not talking about owning it. They just wanted to make sure that the right people had the right information at the right time so that they could focus on things that mattered to them and achieve the outcomes that mattered to them. The first thing that we learned was that patients oftentimes didn't know where to go to get access to their own healthcare records, or caregivers on behalf of somebody that they're taking care of. And their view of what health records meant was far broader than what was being locked away in many of the EMR systems. And so we used that as an opportunity to create a website that would allow patients to start building that mental model of where they can go in the ecosystem of health records that might belong to them, that they should have access to, and start that patient education process to allow patients to be able to know where they can go, whether they're through pharmacies, whether they're through provider, whether they're insurance companies. A lot of data existed out there, and people didn't know how to get access to it. So we built the connector. The front page of the connector, which Tom is going to model here, is really just a way to educate people on what Blue Button is all about. But the meat of it is when you actually hit Get Started. Go ahead. And so here you can see these are just a few data sources. And the list is going to grow a lot longer than this as more organizations and more industries that see themselves as part of the health value chain get involved. But you can see here, whether it's health insurance companies, the hospitals or clinics that somebody might be visiting, all the way through retail pharmacy chains and labs, immunization registries. These are the things that we heard from people that mattered to them that were not necessarily included in the EMR. So when you go through, you can see that you can search by any one of these. So yeah, let's just search health insurance. And why don't we just click on Aetna, since it's one of the top ones there on the list. And you can see that there's a checklist. And that checklist is meant to start educating patients and caregivers, whoever's coming to the site, about what their provider or organization is doing on their behalf with their data. Are they promoting the use of their data? Are they making it available to view? Are they making it available to download? Start educating people on what these things are that we should be expecting of the organizations that have our healthcare data. Over time, we see this as a major tool to provide more market transparency and allow organizations to start competing with each other on metrics that matter to patients, which are these things. One of the interesting things that we found was that as we were building this, a lot of third-party app developers came to us and said, wow, you're collecting all this information. It'd be great to get access to it. And so we've started building an API which actually has about 30 data points from each one of these organizations in terms of what data they're actually collecting, what the format is, what technologies they're using, and all of that is being collected into one resource that third-party developers can actually have access to. Another interesting area is once you have your own data, you should be able to use it and plug it into apps. And increasingly, more and more apps are coming online that allow you to ingest your machine-readable data into it so that it can pre-populate an experience for you and actually make that data actionable, which we know is really the only thing that matters if we're providing access to data, is how actionable that data can be. And so, Tom, if you want to click on the app section there, you can see we're starting to get a lot of demand from organizations that are creating apps, and these are just a small sampling of them. And we expect this list to be growing dramatically as more apps come online that consume structured health information and take advantage of the Blue Button promoted formats for data interoperability. One of the last things that I think is worth noting here is that it's been very hard since we launched this to actually get a lot of information collected. There's a rule inside the government called the Paperwork Reduction Act that actually limits the amount of questions we can ask. So over the last 6 months, the team has been working very diligently on getting the approvals in place so that we can start promoting this in a much more kind of wide distribution format, where we can actually start sending out the form that organizations would need to fill out to get listed on the connector, whether you're a healthcare organization that has data or you're an app that wants to be promoted on here. And just this past week, we got approval for the PRA process to allow us to now go do that. And this is a big deal because now we can start all sorts of really great campaigns to promote one city getting more healthcare organizations on the connector than another city, and other things that we could start doing and getting really creative and using the next round of Presidential Innovation Fellows to really drive more use of this tool, which we find is going to be a great driver for market transparency. And so with that, I just want to thank the team for all the work that they've done in helping to bring one of the few open source projects to bear, and the entire community who's contributed to this. It's all open source on GitHub, and feel free to contribute if you're a developer, and feel free to come to the website bluebuttonconnector.healthit.gov. And now that the link is live for your organization to be represented on here, we expect lots of organizations want to make their patients aware of what they're doing, and we can start promoting it and getting more people to understand what good is being done for data interoperability and patient engagement here. So thank you very much.